In this video, we explain the principles of important parameters for understanding the patient's condition: resistance, compliance, and the expiratory time constant. To start with, let's have a look at some practical examples that explain respiratory mechanics in a simple way. The first example shows different resistances, but the same compliance. The drinking straw with the smaller diameter represents higher resistance, while the straw with the larger diameter represents lower resistance. The balloons are exactly the same, so compliance is equal. When the balloons are inflated to a similar volume and the air is then released, we can see that the balloon with the higher resistance straw empties slower than the balloon with the lower resistance straw. The longer the time needed to deflate means the higher the time constant. Now we show you different compliance with the same resistance. The drinking straws are the same size, so resistance is the same. But on the left, we have just one balloon, while on the right, we have one balloon with another balloon inside it to represent different compliance. The one balloon on the left represents a thinner wall and therefore higher compliance. The balloon with another one inside it on the right represents a thicker wall and therefore lower compliance. When the balloons are inflated to the same volume and the air is then released, we can see that the thicker wall balloon on the right deflates faster than the thin wall balloon on the left. Once again, the longer the time needed to deflate, the higher the time constant. The respiratory system time constant, which is abbreviated to RC, is the product of resistance and compliance. As reliable data for resistance and compliance are only available in passively breathing patients, all Hamilton medical ventilators use an alternative method. This is based on the analysis of expiration and provides a breath-by-breath measurement of the expiratory time constant, which we abbreviate to RC-EXP. RC-EXP has another advantage over RC. It also takes into account the resistance on the expiratory path of the ventilator. RC-EXP is a measurement on all Hamilton medical ventilators, which was made on the expiratory portion of the flow volume loop. It is a reliable measurement in both passive and spontaneously breathing patients. In a normal lung, RC-EXP is normally between 0.5 and 0.7 seconds for adult patients. RC-EXP of greater than 0.7 seconds is considered long and indicates increased resistance, which means a longer time is needed to empty the lung. This could be due to the patient having COPD, asthma, or bronchospasm. Other causes could also be secretions or an endotracheal tube obstruction. RC-EXP of less than 0.5 seconds is considered short and indicates decreased compliance. This could be due to certain conditions of the lung and/or the chest wall, including ARDS, lung fibrosis, atelectasis, kyphoscoliosis, increased abdominal pressure, pneumothorax, or large pleural effusions. In mixed lung conditions, the expiratory time constant is usually in the normal range, so it's important to check the compliance and resistance values, because a mixed lung condition that combines decreased compliance with increased resistance could result in a pseudo-normal time constant. By understanding the patient's condition, you can easily optimize settings on your ventilator, such as tidal volume, driving pressure, and plateau pressure. In addition, you can use the expiratory time constant to set the respiratory rate and the I/E ratio.